Hi, welcome back to our modules. I'm Dr. Stephanie C. Holmes. And what I want to do today is update something from something I previously said earlier in this professional model, or if you're watching this as a couple, I had made an assertion in rule out diagnoses and talking about the accuracy in diagnosing adults on the spectrum. And when I recorded that about 18 months ago, I was of the opinion of the research that I had that autism and narcissism were rule outs, meaning one or the other, and that they could not be co-occurring. And so I've created this graphic, and I want to kind of update what I believe, what my own research is showing, which being a part of a group of clinicians and coaches who focus solely on the autism spectrum in marriage, I want to kind of go back over looking at all the things that make up the autism spectrum profile. So you'll be seeing throughout our discussion today, I call it the bingo board, but the different representations and different criteria for autism spectrum. So let's start with the center of our bingo board, right? The autism spectrum. At the center of the autism spectrum is self-referencing. Remember, you may have heard me said before that autism means self-ism. It is different than selfishness, which in selfishness, I am acknowledging and choosing between you and I am choosing myself. And so there are some things that will look very similar with narcissism. But self-referencing really pulls into the concept of theory of mind, that the perspective and the information that I have, this is based on me, myself. I am referencing myself. If I don't need this, then I don't think maybe you should need this. And we're going to talk about that a little bit more as we look more at the graphic. So up in the top, I guess for me, what I'm looking at is the top left is analytical and logical thinker. So I think that most people who are doing any kind of diagnosing at any level would say, yes, that is definitely one of the core pieces, that the analytical, logical part of the brain is outweighing the emotional, relational part of the brain. And so you can listen to some of our podcast or go to our YouTube channel. And I found some work by Dr. Jim Wilder who is a neurotheologian that combines some neuroscience with theology. And so these have been great concepts that we are using in our approach with neurodiverse Christian couples. But at the heart of this is tending to lean more left-brained, more analytical and logical. And so there is usually challenges in social relational. Now, in some situations, your client may say to you, in every other sphere, I'm doing just fine. At work, I get along with people. At church, maybe the pastor and everybody believes this person is like wonderful and friendly, which is great and true. But it also, we're going to see the biggest ime in intimacy and connection, which is that next piece. Intimacy and connection and the closest relationships to this individual are going to be usually what you're going to hear from the spouse who is not autistic or children of someone who is on the spectrum. I don't feel connected. I don't feel close. It feels like there's a wall there. I'm trying to connect or I want to do things, but it feels like this individual would prefer to be by themselves and prefer to be isolated. So the next thing you're going to hear from a non-autistic spouse is communication. So if you have any understanding that communication is more than just the exchange of information. When I did my master's level classes in communication and conflict resolution for the purpose of being a mediator, you break communication down. There are so many different things that are happening in communication. A big piece of that, which is affected by the spectrum, is social pragmatics and semantics. So how words are used, the sentence structure, the context of which that we use the language. Individuals on the spectrum tend to see communication as more transactional. Just the facts, ma'am. What's the information? Need to know basis, and struggle with the use of communication as a way to connect. So I put these three on the top together because when you're combining this analytical, logical approach with some missing of social cues and misinterpretations of what people are saying within that context and leading to this break in emotional and connection, that's one of the key pieces. So for individuals on the spectrum, they also tend to have struggles with regulation. Now, sometimes you hear this term as meltdowns or shutdowns. And so meltdowns is kind of falling out of favor. So we'll use the term dysregulation. For some people, that might look like a heightened response, or maybe a person is escalated. Maybe they say things without filter. Maybe they throw things, break things. Sometimes, not always, but some might also have might physically attack or break things, or in some cases, it does lead to domestic violence, but that tends to be rare. But it also might be dysregulation into a flight or freeze or fawn response. So it might be constantly escaping. It might be just freezing, deer in the headlights. And then there's new area called fawning, which is I'll agree to anything you say, kind of a false agreement. I agree to whatever you say to make the stressor or to make you go away. So this can look like anxiety or agitation. And so depending on the person's temperament, personality, and upbringing, it might be different on if you're going to see more of an anxious, avoidant type of presentation, or one who gets agitated and spun up. The next one is social preferences and interactions. Now, so many myths exist out there that, if this person has a friend, they can't be on the spectrum. If this person got married, they can't be on the spectrum. People who are on the spectrum just want to socially isolate. That's not true. But it tends to be the social preferences and the way the individual wants to interact tends to be around the things that make that person comfortable. So maybe if that person is leading a Bible study versus being in a Bible study, if I'm leading the Bible study or I'm leading the workshop, then I'm in control of the room, essentially. I'm guiding the information. I'm kind of the authority in the room. And so many people who are in academics, I feel, are probably on the spectrum. So I might prefer interactions with those closest to me in activities that I enjoy. And I also might prefer to have those things that are my specific passions and interests. That might be part of what I enjoy. And that's how, if I'm on the spectrum, that's how I choose to relate. Executive function, we can see two really big things. We can see more like an ADHD type approach of more, I can't find things, can't order things, time management, the order of steps to do something, lack of follow through. But it could also be combined with a rigid black and white type of presentation of a person who is on the schedule. This happens at 8, this happens at 9, this happens the schedule, don't disrupt the schedule. So executive function can be one of those two extremes. And just because you're seeing someone who's kind of affable and friendly, maybe a little absent-minded professor, that's one presentation of adult autism, but also is the rigid, I don't like change, this is upsetting to me. And so the more rigid or black and white a person is in their thinking, if you look at the DSM criteria, there's 2 quadrants actually that you can score someone on. On the rigidity is one all by itself. So someone could be autism level 2 just on their rigidity and their preferences. So the black and white thinking, what you're going to see, especially in your work, which is really frustrating, is many times the non-autistic spouse is willing to have some kind of compromise, is willing to try to negotiate towards the middle, but the person on the spectrum tends to be an all or nothing, zero-sum individual. So compromise and collaboration is often really difficult. I'll actually hear from some of my clients, they say, well, she always wins. Now, when I really press into that, what does that mean, she always wins? Well, if he had this solution and she had this solution, A and B, anything that is not A is a loss to this person. So even if we met in the middle, to the person on the spectrum, oftentimes, that is a loss. So trying to create win-win solutions are very difficult in this situation. And you might experience a lot of pushback or agreeing to something, and then you come up with a strategy and the person's not following through because they then start to say, oh, y'all are all trying to control me, or this is a demand. And that's another place that needs more research, is what's called the demand avoidance profile, which can also look very similar to narcissism. Also, what's key in criteria is theory of mind and perspective taking. Theory of mind works a lot on empathy, it's compassion. It's not that a person doesn't feel something towards someone. So someone on the spectrum can feel, I feel sad. You feel sad. You're telling me something's happening. I feel sad. I don't exactly know what to do, which would be helpful to you. So example I usually give is, oh, my wife just told me that she's really sad over something. I know it will help. I'll go change her oil. So that is a compassionate response, kind of, but it's not something that really brings comfort to the person. So there's kind of more sympathy and sometimes a lack of what do I do. So also what we're going to see in the marriage itself is something you might want to look up called the double empathy problem. So we usually say, oh, someone on the spectrum has an empathy problem or they have a compassion problem. But really, when you look at the couple themselves, there is double empathy issues between the two of them. So the person on the spectrum might be struggling because of theory of mind and perspective taking and knowing what to do in compassionate care. That is true. And there's a challenge in that area. But also the non-autistic wife might have some empathy issues going on with her too, simply not understanding sometimes what is a neurological issue. Sometimes many of the wives I work with erroneously believe, well, we have this diagnosis now. I've told him what hurts me and what needs to change. And so, 2 weeks later, they're thinking now that he suddenly has this knowledge of being on the spectrum, he's just going to change everything and do everything right and correct and relational. And that's not a correct, it's not a correct view, because we're not trying to cure or neurotypicalize anyone. We have to work within the framework that we have of two different neurotypes. We are trying to build relationship. We are trying to build togetherness, but it's going to look a little bit different. And so the non-autistic spouse has some struggles, sometimes changing their assumptions, and might say things, you did that just to hurt me, right? Placing intention on things that might not have been intentional at all, but because of that neurological difference, simply didn't understand the impact of what that behavior was. Now, if you go kind of lower down on the screen, I take these 6 boxes here, and these 6 boxes are going to present so differently. Interest and passions, trauma, sensory profile, family of origin, masking, camouflaging, and co-occurring issues. Okay, so you've heard me say in other videos, a huge problem that clinicians and coaches make is the interest and passions. The interest and passion does not have to be weird or eccentric. In fact, Dr. Temple says if someone on the spectrum goes into a job or career in something that they have a passion and interest in, they're probably going to do well because they've discovered a niche and they are great problem solvers in that area. Someone on the spectrum can work in any field. So to say, oh, well, this person is a teacher, and so that's not a STEM thing, so that person can't be on the spectrum. No, we do find a lot of people working in STEM, working in academia, and even in arts and entertainment. So the interest and passion has to do with the moderation or lack of moderation, the amount of time, not only doing it, but in the MIGDAS-2, which is a assessment that I use, part of the restricted and special interest piece is about how much time is the person involved in it, thinking about it, planning for it, wishing that they were involved with it, and then what's that impact on marriage and family. And so the most common by far of anyone that I've met on the spectrum is work. Whatever they are doing in their working field, then it also becomes a justification. So let's say it's technology is the restricted interest, and they work in IT or programming of some kind. So when they're home and they're doing research on their computer about computer stuff, or they're reading magazines or trade magazines, they'll say to you, I'm doing that for work. But it might not be paid work. It might not be something that their bosses ask them to do. It's because I like it and I'm interested in it and I want to do a deep dive. So Hans Asperger, of whom Asperger's syndrome was named after, and we don't use that designation anymore, what he noticed was like, a ferocious, like how the people on the spectrum kind of attack the research area of like consuming it. So it's the how the research is done, what's done with this information, and then what's that time moderation. So that's going to be something for you to look at. And usually asking a spouse is going to be how you're going to get to, is there a restricted special interest? A new part of the field is trauma. So there is a book out there called Complex PTSD, and it is very true that there are some things from having a traumatic event and symptoms and criteria of autism that can overlap. That is very true. So in certain circumstances, there can be both. However, while it is extremely important that more and more people are being trauma informed, sometimes once a therapist sees trauma or hears a trauma or there's trauma in the person's background, they stop looking for other issues. And so you would expect that if trauma was the main issue, that when the trauma is dealt with and healed and worked through, then these other symptoms that look like either ADHD or autism, you should notice some change there. So this is very confusing, but if there is trauma present, then you're trying to disentangle what might be from the traumatic event and what might be spectrum. But remember, the spectrum is lifelong developmental. And so we would expect that these things go back into someone's these special interests, the analytical thinking, the communication, the theory of mind is going to be before that traumatic event. So that's something that sometimes throws people off as well. Kind of related to that is family of origin. So what we know now is that there's an 80% hereditary rate of autism spectrum without cognitive impairment or delay. And so there might be different presentations if a person on the spectrum comes up in the home with a mom on the spectrum and dad is neurotypical, dad is on the spectrum and mom is neurotypical, both parents are neurotypical and maybe it skipped a generation, or both parents are neurodivergent. So finding a little bit more about other people in the family who maybe have some sort of neurodivergency might help. And then kind of understanding that there might be, again, these differences. And then was it a nuclear family? Was it a single family, single parent family? Was it a blended family? Were they raised by another caregiver or grandparent? So that certainly can play into that trauma piece. The sensory profile, in my opinion, there are at least 4. Most of you may know of the 2 main ones. Sensory aversion, that's too much. I call it 2. It's too hot, it's too cold, it's too bright, it's too loud, it's too scratchy, it's too tight, it's too thick. There's aversions are just a hypersensitivity, which is real to that person. That's the sensory aversive profile. There's also sensory seeking. So that is kind of exploring through hands, kind of, we had a little guy that we foster cared for a little while, and he was a sniffer. He liked to sniff things and get right up in your body boundaries and sniff or touch or caress. And it's just how he explored the world, but it wasn't socially appropriate. So there's kind of this seeking way. Then the third way is something called underregulated. And these are the people most missed. And this would be an example of Dan. If you've watched any of our other videos or podcasts, it's been joked like Dan will eat anything. Dan can go in anyway. No smell, other bothers him. He wears short sleeves and shorter kind of basketball pants, and when it's winter. So there's this kind of, it really takes a lot for that person to even be aware of the sensory environment or to be affected by the sensory environment. And then there's a fourth one. I can't remember the name of it, but it's very in tune and very focused on the sensory, but may not be too much or constantly touching, but kind of hyper focuses. And even in discussion and communication, talking about, oh, look how bright that is, or see that butterfly, how purple it is, or it's been hot. Like there's sensory words that are constantly being used. And it feels like when you're having this conversation that these facts get kind of interjected into your conversation and it doesn't feel like a connected conversation. The person doesn't seem to be bothered by it, but is very attuned or very distracted by what's going on in the environment. And then masking and camouflaging, especially, again, we're talking about neurodiverse Christian couples. If you grow up in a Christian home, if you grow up in certain parts of the South or maybe the Midwest, eye contact is very important. You could get your eyes slapped out of the back of your head if you did not give someone eye contact. So there could be things that were taught, maybe drilled into someone's head, that you always give eye contact. So the person may have learned to kind of fake it, camouflage it, mask it. What's going to be important is to also ask that person how they feel about eye contact. Also ask their spouse, do you get a lot of eye contact? Because it may have been kind of conditioned or kind of socialized in based on how a person grew up. By the time that adults are maybe in this space, which our research showed that 86% of those that we researched who took our survey out of 322 respondents, I believe, 86% were diagnosed over the age of 30, and usually when some other kind of neurodivergency was diagnosed within the family. So when we're talking about autism as a developmental difference delay situation, it's not saying that a person cannot learn something. It is saying that these things have to be maybe taught, or there needs to be a different way of integrating new skills in. It's about skill building. So be careful, because in your office, how someone is presenting, sitting one-on-one with you, and how they present when they're in other situations is going to be quite different. People on the spectrum generally do like to talk about themselves. So if you're interviewing them or interacting with them and you're not challenging and you're not pressing in on anything, you might not be seeing that. So understand that masking and camouflaging is kind of a survival skill that people on the spectrum have learned. And women on the spectrum mask and camouflage even more, just simply how we socialize young girls and women to be more social. So don't let that throw you off. All right, the final one is co-occurring issues. Now, previously, when I was talking about personality disorders and ruling out and differentiating, I do very much believe now, based on research, based on talking with other colleagues, you can hear a whole podcast on this that I did with Jody Carlton. That would be on Mental Health News Radio. One of the first 10 or 12 episodes that we did was with Jody Carlton on this topic of a co-occurring issue of narcissism and autism. So I used to believe that was a rule out, but if autism is neurology, narcissism, while they're very different approaches as to what is the origin of that. It could be, trauma or family of origin. Maybe some are saying now some neurology is involved in that as well. What I had said in the previous video was that theory of mind. How can you lack theory of mind and also have higher theory of mind? And it's interesting what Jody Carlton said in our interview. She said, think back to COVID, Stephanie. Think back to some people who had pretty high and decent theory of mind. Were losing perspective no matter which place of the political you were on, COVID protocols or masking or whatever. People who were highly compassionate and up until this point had pretty good theory of mind, but in certain circumstances were not showing very high theory of mind or a perspective taking or ability to see another person's opinion or point of view. And so what I'm kind of seeing now is, especially in homes where a child, grew up on the spectrum, is bright. Maybe the family made them the golden child. They achieved well. And maybe there was a lot of, you're smarter than people. You just don't have friends because they don't get you. You're superior. There's been building in some mindsets of superiority or entitlement that can also either manifest in what would be fully narcissistic personality disorder or having narcissistic traits. A book that I found that I highly recommend is called The Pandora Problem by Dr. Jim Wilder. And it talks about the inner narcissist that could be in any of us. That also helped me change my opinion some, that there are factors that can lead towards our flesh and towards a sinful nature, towards selfish choices that a person can develop, either narcissism, the full-blown diagnosis, or narcissist traits, or maybe even growing up with a parent that was a narcissist or someone close that was a narcissist. And because people on the spectrum do tend to camouflage and kind of pick up surrounding, might pick up different things. So part of masking, so I'm tying these in together. I knew when my daughter came home from school, I knew who she sat and had lunch with based on how she talked and presented herself. If she ate with a certain person, her mannerisms would be a certain way. The next day she ate lunch with someone else. They kind of pick up little pieces from different people that they are either wanting to be like or hanging around. So kind of being careful of your friends is for sure important for those who are on the spectrum, because they kind of start to morph and develop little pieces of that person onto themselves. So with that being said, I do believe there can be co-occurring. What's more important is not just simply to jump to a rule out because someone's presenting so narcissistically, it can't possibly be autism, or someone is presenting so autistically, it can't possibly be the narcissism. So I think as you are kind of weighing that out, what's more important is if you see the entire picture, it's all of the traits together that will help you come up with whether or not this person is on the spectrum if you're giving a professional opinion. Now, the assessment that I use, that if you have a master's degree in counseling, education, social work, or something in that field, it doesn't matter if you're licensed or not licensed, but if you have a master's degree in a helping science, so to speak, you can use something called the MIGDAS 2, MIGDAS 2. This is a great assessment. You can do it in under 3 hours. And one of the reasons I like it is because it incorporates data and observations from someone else. So since I primarily work with neurodiverse Christian couples, I can invite the spouse in, and after each section, after the person has given their answers, I can also invite the spouse's observations in, which will be part of the scoring process. It's a great tool. You don't have scale scores and all these things you have to do. You meet the criteria, which is based on the DSM-5, and there's a training course that you can do on it. And then the more that you are around more individuals on the spectrum, you will hopefully broaden your perspective of what is and what is not the spectrum. So I hope this little updated piece on identifying adults on the spectrum has been helpful.